Health is a human right and one of the most important worldwide social goals. The promotion and protection of health of people is essential to sustain economic and social development and contribute to a better quality of life and to world peace.
Post-independence, India was committed to universality and a nationalized health system. The Bore Committee in 1946 observed that the majority of the population was suffering from malnutrition, anemia, and communicable diseases. It emphasized on a strong primary healthcare services and an investment of 12% of India's GDP into health. But India's public health expenditure is abysmally low even after 73 years of independence. We have not been able to achieve the goal of 12%, and a large population still suffers. We need to ask our politicians why.
The Alma Ata Declaration on Health for All in 1978 set out a broad set of principles, comprehensive primary health care approach. It is a historical declaration as first time elected representatives from 134 countries and 67 international organizations agreed upon a common definition of health, that is, ill health lies beyond the four walls of hospitals. Alma Ata Declaration completes 42 years in September 2020. It is perhaps the right time to take a look, re-look, and examine as to what has happened to this document. What has been the commitments of government to Alma Ata Declaration?
In India, more than 70% of population lives in rural area. Lack of access to emergency medical services proven to be disastrous. According to National Institute of Emergency Medical revealed, more than 20% of patients requiring immediate medical care died solemnly due to traffic delays from rural sectors. Let's all collectively demand for responsive ambulance system, more public health centers, community health centers and sub-centers, and affordable medical care. Death is inevitable, accepted. But let us be the one who says we do not accept that a child, woman, man dies every 3 seconds simply because he or she does not have the drug you and I have. Let us be the ones to say we are not satisfied and that your place of birth determines your right for life. Let us be outraged, let us be loud, and let us be bold.
Is healthcare accessible in India? During the year 2017-18, it was reported that India spent only 1.28% of its GDP on the healthcare sector, which was far more lower than its neighboring countries like Indonesia and Sri Lanka. What is accessibility to healthcare and why is it important? Accessibility to healthcare means that an individual, irrespective of their economic background and geographical location, can access, afford quality healthcare, no discrimination. Why is it important? It is important because it's a right.
Why is it that only 37% of women got access to healthcare as compared to 67% of men? This disparity is not just in healthcare but rooted in socio-cultural factors, unequal power relations and patriarchy, lack of access to education and unequal pay, poor nutrition and sanitation. Indian women are also found to underreport illnesses because of cultural norms and expectations from them within the household. There is a need for comprehensive approaches to health that specifically focus on women, not just as childbearers or economic resources, but as citizens deserving of social and human rights. Health for one, health for all.
High mortality rate than higher caste, lower healthcare utilization, and high discrimination. This is all Dalits find every day when we are talking about healthcare for all. Do Dalit lives really matter?
From communicable diseases, malnutrition, mental illnesses and addiction to harsh environment, limited human resource and low funding, the burden on tribal health is a lot. And when the tribal population depends heavily on the public health system, the question arises why tribal people suffer from inequity in health and health care compared to others, and what is being done to bridge this gap.
In the world, approximately 1.2 billion people live in extreme poverty, having income of less than $1 per day. Every day, millions of people are being plunged into poverty because of their healthcare expenditure. Many studies show that poverty results in poor health, resulting in high mortality and morbidity rate. Why should poverty cost a life? Government should ensure everyone has access to free quality healthcare. Why? Because it's a right.
Health is a right, irrespective of religion. But the communalization of health sector was seen during the Delhi riots and the corona pandemic when Muslims were denied healthcare services. You cannot deny health on basis of one's religion.